According to the Health Ministry, the daily figures of new COVID-19 cases seem not to be prompting caution among Kenyans who continue to ignore health directives and appear to have moved on with their normal lives. Treasury is, however, taking the pandemic seriously and has set aside some money to help in containing the virus. In addition, more health workers will be hired to facilitate the setting up of 300-bed capacity hospitals in each county.
We have also allocated an additional shilling 500 million to supply 20,000 locally made beds and beddings to public hospitals, and shilling 25 million to support the establishment of 50 modern walk-through sanitizers at our border points and main hospitals across the country.
The government is focusing on how to give local manufacturers a chance to provide much-needed equipment necessary for the fight against COVID-19. This includes locally produced medical ventilators as well as personal protective gear for medical workers.
Shilling 1.2 billion is proposed for the recruitment of an additional cohort of 5,000 healthcare workers to support local health staff for a period of 1 year. This will enhance our COVID-19 response capabilities and strengthen implementation of the Universal Health Coverage Program.
Following the adverse effects of the pandemic on Kenyans, most of whom have lost their daily sources of income, Treasury has set aside funds to employ over 200,000 youth under the Kazi Mitaani program.
I have set aside shilling 10 billion under the Kazi Mitaani program. This Kazi Mitaani program will be targeting unemployed youth in the major cities and urban settlements of Nairobi, Mombasa, Kisumu, Eldoret, Nakuru, and other major towns across the country. The youth will be engaged in fumigation, stormwater drainage works, cleaning of markets.
This in addition to the 57 billion shillings that has been set aside to help aid vulnerable families who have been directly affected by the pandemic.
The 8-point economic stimulus program targets to cushion vulnerable citizens and businesses, particularly those affected by the COVID-19 pandemic. The stimulus program will focus on keeping the food supply chains functional while promoting the use of locally produced goods and services, thus securing the livelihoods of daily wage earners.
As the budget estimates were being read, 121 new coronavirus cases had been recorded in just 24 hours, raising the total caseload in Kenya to 3,215. 44 patients, however, got a clean bill of health and were discharged from hospital. However, 3 people succumbed to the virus this morning, bringing the death toll to 92. Once again, Nairobi County led the pack with 49 new cases, followed by Busia, where 37 truck drivers tested positive. 20 new cases were reported in Mombasa, 5 in Kajiado, and 4 in Migori. Kiambu and Kilifi counties recorded 2 cases each, while Nyeri and Murang'a had 1 case each. Dennis Matara, K24, Evening Edition.